Good luck, everyone. It is Thursday, June 17th. This morning we have both Premier and Dr. Patterson speaking before we get into questions. We also have Julia here today as our interpreter, so thanks so much for being here. We won't have televised updates next week. We don't have anything planned, but information will be updated daily. You can go online or on social media, and if there's a need, we will organize something. Thanks so much.
On June 17, sibulate ama Dr. Patterson kabaniniakut pinasuako si ulat tumi takustaw katala mga takaw yung manang ito tukusi titigakan na katana majugo kanulingan na mga ta.
Nunavut mi ublache ko papi ublang yung takwa nuban na yung akto Nunavut ilo ni hunding ito nutang ni pakang ito. Katiluk taaslu takwa Nunavut ilo ni 8 nuban na yung akto matama takwa tamang mitabanya kalung ni slutin. Dahil mga takwa nuban na yung kalung iti daw kimakmat 254 nuban na yung akawon na tut mamihimayot. Amma takwa nahaw tita Tuesday tadlima magwani Tuesday na how to pay takwa nuban na yo taray ko tumi kapiyaw himayut 18,091 hibud la pami nuban na yo taray ko tumi kapiyaw himayut matakwa tublia ni kapiyaw himayut nuban na yo taray ko tumi 15,867 kuwena ko ni takwa na how to time ublutuma ko bakpadla ko yang mata Tana nuban na kaya kuti kapo nutak kan ito nga yung Pfizer dahil na inang nuta atak Moderna may atakakto tana li Pfizer nutak kan ito nga yung tana hanat tayo limit ikpagkapigalaw man taban niya kalungni matay ko ajinitakot talaw matay ko kapiyaw yak toktot ami hut siya may ngulaw matatana ko na ko ni Ami takwa ukiuli 12 to 17 mun kapayayak tulaw mata. Amma kalung ni hilatani to takwa nunulik kani pigan na matataw. Anya ukaluk taw na po hitakwa nutaka kapayaw ko na pio tayo to kapayaw ko niya po nutaka kitni 12 to 17 ukiyo kaktunun. Anya ukaluk lutit tayo kwa kapo kay gini kapo kay gineta tikipata kapiyaw yung mga mata. Tana Pfizer at yung Moderna mitana tukok taw giyarangan maawla tigarangan namu nakyu tigarangan namu mer niglinak to yung migiyakang man imakata na ataw hit na alutit kapiyaw yak to titsina mata nunalingnin tayo matawhin tawher lo titikin niya na pata kapiyaw yak tok te gumak pahi ta kunutak ay tanali Moderna nunaling ni kapwa karani ka takimay hong mata tana nuban na yata kaputi ni kaya tana Pfizer yung imaka kimay lang imata nunaling nutakwa kapiyaw wang na robit ubalo batakwa ang ayok nutaka kapiyaw kun na rukyo dahil ukalugumak po na kapo Pfizer tikik kasi nagununaling nun. Sana kingudla pagilo iya ukwak padla ukay na hok tunga kinap pa mimato ang matok taluhe agawel mitsa talugit kanigilo ang tangid luta amata kwa kating hok tabu ino katibu amihulo at tangid lugit kapiyaw yak tolo tika nuban na yata kay kutimi amma kuwaya huk pagduta ino katibu kayo siya talugit pinapugot ubdokat siya na po hinunabong miuto yun matna himabunga kuyali masunga tako na alat siya takapi nunabong miut matnam. Good morning. Nunavut is reporting no new or recovered cases of COVID-19 today. There are still 8 active cases in Iqaluit. And to date, there has been 254 recoveries since the outbreak started here in Iqaluit. As of Tuesday, 18,091 people in Nunavut have received their first dose of the COVID-19 vaccine, and 15,867 are now fully vaccinated, and we are working to get updated numbers as soon as possible. Our Pfizer clinic started this week And from the photos I've seen of the walk-in clinics here in Iqaluit, it looks like we're off to a good start and a really strong start, and that is encouraging, and I applaud anyone that went there. For those outside of Iqaluit, please make an appointment through your local health center for your 12 to 17-year-olds. And it is important to remember that Pfizer vaccines are more difficult to transport and have a much shorter shelf life once thawed. Now is the time to get teenagers vaccinated. Please don't wait, because we can't guarantee that we'll be able to administer Pfizer outside of these community clinic dates. And as always, mask up, wash your hands often, keep strict physical distancing, keep your bubble small, get vaccinated, and now help teens get vaccinated too. Stay kind and positive to one another. Do the right thing for yourself, your family, and everyone around you. Take care and stay safe. Thank you, Nunavut Meal.
Good morning. The situation in Iqaluit continues to improve. We have had no additional cases stem from the exposure notices at the end of last week. There have also been no active cases identified following the positives confirmed in two school students this week. Last week. This is encouraging, and I urge people to be patient a little longer with the public health measures. Following the measures will help end the outbreak and put us in a better position to enjoy our summer. On Tuesday, vaccine for youth aged 12 to 17 began rolling out across the territory. Vaccines arrived in Arctic Bay, Clyde River, Iqaluit, Nauyat, Pangatong, Pond Inlet, Kikiktajuak, Seneriak, Resolute Bay, and Kugarok. Grease Fjord's delivery yesterday was delayed by weather and should be arriving today if the plane can land. Vaccine should be delivered to the remaining communities by June 21st.
Ulako, Iqalun na kanwin yu pius de valleyu, asingin ni pitakakan sa mangito. Nubat ni wanatu mi take wanalune teo si ma yuka kaning ito che mga maune ile sabi me ile nyati na kawiyaw yuka yuma pinaswa ko si yumi taman nalo tusa ko minatu ni tileo kakalu kikutuin na lima kinu isa kanna kullu inu lima no ane atulaga na makanotu ko taka tilukta malitu be kanotu ko tao yu ikayu taka nyatu taman na siya mapalya gundi niangan awya siutian niagatalo amma epeme kanimagi kutinu kaputinu inu sutui ukiuli top ni 17 not kapayaw hatta silawngata tamane Nunavut kanimagi kuti ipia demo kangatua pemo ilolimu nauyano panetu mo mitimatale makakata mo sana kaya mo kausuitu mukuga mo laula titaw si malatu kausuitu me ipasa kingubaga si malatu sila pi yutigilo ko kangata so ka na laungemat ulume tikikaya ngwatu kanimage kuti nuna lelemano tikisimalaga yang ngwatu sibula pame tamana kanigiyanga ni June 21 atutaw na sigayatuti.
Here in Iqaluit, youth can go to the mass vaccination clinic at the Curling Hall that began yesterday and continues tomorrow from 1 to 10 p.m. at the curling rink. The vaccine's arrival, availability, and most importantly, efficiency mark a significant step toward further reducing restrictions territory-wide. I urge everyone who is eligible to get the vaccine. Call your health center for an appointment. If you are 18 and over, it's not too late to get your shot. There is vaccine available. Thank you.
Tamane kalun inu sutui kapiyaw ya tokata nangata kanimagi kutinu curling rink me take on it. It was the pigia lautu. Takwalo Sulikayu Sina to the Haupamo, one me pigia take 10 more unduku. Take on a curling rink me amalo. Hanimagi Kotinu Capuchi Takwa twin downing in the pillow up to me Takwa Sama Palyang in the Saunanga Nubat the one up to Nunavut me Tamana Atotana Swatuni Amalutili Rebunga Takwa Kapia Kataruna to Kapia Yatokataku Okala Katalu Siluani Avimo Uke Ukarus 18 Ungatani King Bangituti Kapia Kasiuti Namayusi Atwina Tahaka Hanimagi Kotinu Kaputisani.
Ken Driscoll, APTN National News. Dr. Patterson, I know it's early. They only started the mass vaccination clinic yesterday. But I'm wondering, based on what you've seen and what your office has heard, how is the rollout going? Is any sort of preliminary numbers as to how many people are taking their vaccine?
Ken Driscoll, APTN Kuni Pivalia Yulagi Kuni Ipasa Takwa Tusalotavo Hanimagi Kotinu Kapia Yatokatatu. Utigil alla bisini to Sasima Bisi Hatilatang Mangata Kapia Yatokatalotu.
As of yesterday, or at the end of yesterday, we're tracking 639 doses of Pfizer administered across the territory, most here in Iqaluit, so that's very good news.
It was the take what to Salota Tamane 639 in need to Kapia Yatokatalotu Pfizer Tamane Nunavut Atutosima Iqaluni Piloatu Takwa to Saruminatiatu.
Yesterday at the mass vaccination clinic, things were moving fairly smoothly over at the curling rink. I'm wondering, are there any plans to export the mass vaccination clinic model to other Nunavut communities with larger populations, like Rankin, Cambridge Bay, those towns?
It was a tema Kapia Yatokatana to Amisu Isumasto to take on Katalawata, Inga Atiatualo Valula Tamana Nunali Asingin no tema Atotao Tikayanga Isumagisima Visio Stolo Kangastanamo Ekaloto Tiamotamakunumagala.
Most of those communities have already had mass vaccination clinics in the first round and have clinics scheduled for Pfizer for youth coming up over the next 4 or 5 weeks.
4 or 5 weeks?
Yeah.
Takwa tema Kapisa Katayumata Temele Katarela Wata Nunalini Sivongago Tema Sule Akasima Paisimo Inusutuno Hanimagi Kotini Kapisa Katani and the Mo Tamana Tisamani Talimani Lukiapina Savasium Neotuni.
Lakot Tobi Taxibisi Kuni Kakugutli Bagnaxima visit Tana Nunavut Akotinga Asitjang Mga Takwat Nukanga Gutaw Simayui Kasubat Luktaw Mga Nubak Jong Nunaring Nutikin Patakwa Kapio Simayui Mariklubu. When will you plan to release a replacement to Nunavut's path that will explain how restrictions will work when COVID enters a community based on the community's vaccination rate?
As soon as we get the details worked out, and some of it will, as you said, it'll be a graded response where we move away from the immediate sort of complete lockdown to something that's more tailored depending upon the vaccine level or the level of vaccine uptake in the community. That's probably at least a week or so away from where we are right now.
Tusao Malitua Tata Kuninga Hanwilinga Ningin Akasimana Tangin Tamakuninga Matustimagea Halon Atawaya Harni Palea Nebomali Lugi Tamana Kai Pinasua Summe Atao Summe La Pinasua Sinapa Tamakuninga Akasimagea Lugi Kamagea Kana
Savikataaq, Natsiak News. Do you have an update on any of the individuals that have been hospitalized either in the last week or earlier in the outbreak?
Nunavut news kunni tana tukusisi taugeasti mavisi kanuilingalam mga tatay ko ani avitigo inilati tauge kakatalautuni.
There's no one in hospital at QGH right now. There is one individual in the Ottawa hospital who was medevac who remains in hospital.
Mana tusasti mangitigo kanuilingalam mga ta kikatani ani avime kisiani tena atauste avlati tauste mayo tusau mayakalo avo kanimasti maningano.
I know that you've been able to find links between all the cases identified in the last week. Do you know where the case last Thursday originated, and were you able to tie that to earlier in the outbreak?
Te kua tustalau talemavo pinasuako siulau tame piutigilwe tisamiu yuyumite na tusako tigiu yavo tusako mabisio kanuilingalam mga.
Yes.
Ei.
Trevor Ray, Nunavut News. What are the challenges of having a shorter shelf life with this particular vaccine now that the rollout has started this week?
Trevor Wright, Nunavut News kunni kanu piyagaya tutigi batamakwa kanimagi kutino kapisi utau katasima yupi utigilwe kanu atu utakakutana gayangwatangi.
It expires quicker, so we can only, when we fly it into a health center or into a remote community, we can only store it in most of the health centers for 30 days, and then if it's not used, it has to be thrown out. So it's really much more suited to mass vaccination clinics than to ongoing use like we've used the Moderna.
Tana pakotigata tangano kanutigi atogasa utigi mga tikiti tamani utiluwe nuna leno takwa atotau yunana resungi sukanya same atogasa gumni su matasul 30 ne uluni takwa 30 ulwe na yumani ulau tiluwe igiya kasu mata takwa sana yausi maningi amisu atautiku kapiyau katane atiluwe kanimagi kutinun akasusima yutau mata.
Do you guys have updated numbers from isolation and contacts here in Iqaluit?
Tusau mabisi katiulam mga tatay ko anitelige kapatut kanimagi hila kanimanatumo nuwatwanatumo 8,000 mayumini pi utigilwe.
Yeah, there's 40 people isolating in Iqaluit right now.
Mana 40 anitelitita.
Ken Driscoll, APTA National News. Dr. Patterson, I'm wondering if you could update us on where the territory is as far as reopening mine sites to Nunavut-based employees.
What was that again?
I'm wondering, where are we on the path towards allowing Nunavut employees to return to mine sites?
Ken Driscoll, APTA kunni takwa Nunavumme mana teme tukotilota sukutiani peta tamatuma tamatumingato tilota.
So as we announced on Monday, there's Agnico Eagle, and there are 3 sites now. Miners can return to all 3 of those. We're waiting a bit for Baffinland because there's the outbreak that hasn't been declared over yet.
Yomite mao kayugama pingasu matatakwa Agnico Eagle kullo kanuigumni palleagalwa tutikisiani utakigata sulibapala kunni kanimanatu taastima yokatilu.
So giving that authorization or approval from a public health point of view, it's not like flipping a switch, so I'm pretty certain that there's nobody back at any of their sites yet today. They're engaging with their staff, seeing who wishes to return, and doing the work to retrain and refamiliarize them with their job. and with the new protocols in place at every site.
Takwa stuli utiruna siti tau semangi mata ekane yati takununga ekane yaya beobatunu takwa ekane yati kutingini okabe kapatu galwa kiku utirumaga yamanga ta ekane yaya lote nutane lo pilri yusi yaya lenne atukata yaya kanne atangini akisisi mane angata utupale anegela atangi isumagin lugwe.
Dr. Patterson, the way the policy is right now for entering the territory, you don't have to spend 2 weeks in ISO if you've had both your shots. Is that going to be the requirement for Nunavut-based mine workers to go to the mines? Will you have to be vaccinated in order to freely go to a mine site and return to your community?
Dr. Patterson, tamani Nunavut me kapiyo simalatiluge kanimagi kutimo utakabi me kataya tu yagunne ngatagula simayokanga tekwa ekane yaya katane atu uyaganne binno kapiyo simatiluge ma'watilote temato utakabi me kataya tu yagunne ba.
It's our preference, and it's strongly encouraged or recommended that the miners get vaccinated, but no, it's not a requirement at this point.
Intan atuta ko gaya tagalwa bo kapiyo simakataluge kisane uyaganne ati tilo talo lo tipingitu kanimagi kutimo kapiyo se nagayatu gati.
Tobi utak CBC kunni kanimata ko nubak tuang na kawnagak tui makursoglutik nubak tuang na mitkawi saktaw yaga kakpat pikangin nakaktaw yun nakpat kayo silaw ngitigdugit. Dana picture kakpa nubak tuang na ilangan ni dana deltaw nakaktaw yumot ilitisimarok pisita kunanga nuruya kuningak tumin. Why do people who report COVID symptoms now need to have 2 negative COVID tests before they're cleared? Does it have to do anything with the Delta variant and what you've learned from the outbreak from the Mary River mine?
Oh, sorry. No, it's been standard practice for a while that, especially in a community where we have COVID, that you'd need 2 tests 72 hours apart or 3 days apart to rule out a COVID infection.
Takwa pilari yusiuga yuhatanga kanimana totakasti matillugu nubat wanatumi ma'watillu tikawisata wakatagaya kaningini 72 ikakai tungani balo pingasu ului tungani kanimana totakasti mayukatillugu nubat wanatumu.
Takwa li kapiyaw simayui nubak tuang nang may kawi saktaw ngin nakakakayakpat nunabumo utilaw nginni. What about, would anyone vaccinated who has traveled still need to be tested for COVID-19 before they travel back?
No, we don't. We have routine testing that we offer to people at the isolation hubs, but it's not mandatory, and we're not routinely testing people who have been fully vaccinated.
Takwa kawisato katanimata. What were you saying? We have not been testing?
No, we don't test people who are fully vaccinated just because they've been traveling.
Kawisa katangitu kutakuninga kanimagi kutinu kapiyaw simamangata ammalo utakibinit katatu takwa kawisa tau katagaya ngatale ania siotinu tanalo atuktaw say nakayatubani.
Justin Matarna, Tech News. Do you have an update on the number of exemption requests for fully vaccinated individuals?
Can you repeat that, please?
An update on the number of exemption requests for isolation by people that have been fully vaccinated.
Tusati tausima visi katio mangata takwa pakasi yausima katagaya tungitu kapi yausima mangata nubat nuwanatu takangitu mo.
There have been 276 exemptions due to vaccination.
276 musimayu takwa kanimage kutimu kapiya usimayu.
Is there any update on whether or not the number of hubs will change based on being used less?
Tusati tausima besti balu tukusiti tigiago tisara kasi takwa kati nakawaya kayang mga ta utakibiyo watu mana tema atukatangusulatilusi?
That's an ongoing thing where their staff from CGS and others are monitoring the use of the hubs, and as we move away from out of territory isolation, use of the hubs will decrease and they'll gradually get closed.
Tana atutaw katena si mama mana ekane yatingin nulo nunalin no gavama kunulo pijit chakati kamagiyaw katatune atutaw kataningi utakabiyo gaya kapatu tamakuninga atukuni paleang usulatilota kati nako paleang usubalong mata amalo kinguniago atutaw ni te amakayatuti.
Trevor, Nunavut News. With the mobile clinic swabbing people and all that, is there still a chance that I guess COVID could be still circulating among individuals who don't want to get tested?
Tan kawisatio watu namituina kawisakatatiluwe nubat nuanatu mekhanemanatu takangi kaloa mangata kawisatao kumakatangi tulipi yutigiluwe kakwa kai nubat nuanatu takatumani utiluwe aitue katangi nusema pale atuina kataka.
Yeah, that's always a concern, and that's why we encourage everybody who's at risk to get tested just to make sure, and that gives us the best chance of finding all the different chains of transmission.
Tamanna ismalu na lema patu teme gutaw yakayanga ismalu nanne batangano kawisataw te kataku yakalo tamakwa kangi sutu nubat nuanatume kanimanatume ane yutakamangata.
Has there been an update for a genome sequencing sample sent down south?
Tusati tausima vesti genome takwa kawisa utausima yu pitutigiluwe.
I can't remember the exact number that's been sent, but so far every sample that's been confirmed is B117 in Iqaluit, or alpha variant, and the delta variant at Baffinland Iron Mine.
Sukui gilatang tagalwa kakatio mga tatakwa aulati tau simayu kisiani ilunati kawisa kaste aulati tau watu tamani B117 me pi yutaka simayu ekaluni takwa lo epangi nalune agatatangi Baffinland kunni kawi yutau simayu.
Ken Driscoll, APTN National News. Dr. Patterson, is there a percentage of total people vaccinated in the territory that you would need to see in order to close down the requirement for the isolation hubs completely?
Ken Driscoll, APTN kunni Dr. Patterson takwa presenting it. Nasa utitigo katilatang mga takapiyaw simayu nakawyi malerosiyo ila sukutiani gaya mga kawyi malerosiyo takwa matuyaw gayatuya ka utakabiyaw gaya kapatu.
Ideally, we want everybody who's eligible to get vaccinated. Right now, it's hard to tie those measures to an exact level of vaccination because some of it depends on which variants are involved or circulating in the south, and we're watching what's happening in other jurisdictions that are easing their travel measures and seeing their experience. Because as we've seen in a number of jurisdictions, easing travel measures increases the risk of introduction and the risk of outbreaks.
Takwa Kikutuina lema kanemage kutinu kapijao sima ku gaya tagaloabu ammalu nalu natune kanun lata takwa kanemage kutinu kapijao sima yu katiu lata lagayangwa mangata ammalu nalianu nubat nuanatumu kanemasima mangata nalu nakata tutukisiani asingini aula tibiu yunakawi sakata tuku takuna kaswakata majugu tusa kaswakata tuku kanuele ulam mangata ammalo maleningini tamakuninga aula kata kaya kana monga yune nasa utingini kawina swakata majugu tukusi sima yutigina swatugu tema akasima gumnamneagata.
Dr. Patterson, in some Canadian jurisdictions, people who are 12 and under who can't get vaccinated are allowed to travel and avoid travel hubs and restrictions as long as they're traveling with their vaccinated family. Is that on the table for Nunavut? Is that something Nunavut's considering, letting 12 and unders travel with family unvaccinated without going to the hub?
Luta Patterson takwale kanata me aula tibi batule mai sumagile we 12 ne ukiule tungane kapajawea kangemata kanemage kutimo aula gonam nagata usima mata ilangini kanemage kutimo kapajaw usima yumni illa kalluti tamane Nunavut mita nunaleno tema aula gonasi titinia gabisi kapajaw usima ngitugalwani 12 ne ukiule ni tungane lo ilangini pakata kata tuakata kapajaw usima yumni.
It's certainly one of the options that's being discussed. As we mentioned at the scrum where we announced the vaccine exemption, it's going to be like this for at least 4 weeks, which gives us time to assess this and time to learn from the other jurisdictions, and then we'll carry on with easing the travel restrictions in some fashion. And allowing families to travel as a group is one option, but it's just one of a few that we're considering.
Tamanna takwa atugasa wayatunila ukausi usima mata kapija usima giatungituna kanemage kutinu amalu tamana kaya tisamani pinaswa gosne tukusakatigi palleane amigata iligutigi palleale gulo aula tibi batune kanata minamituina tamakwa aula katana mo kilile otawasimayo palasiti tawbalea tilugu.
The other thing to remember is that having a much younger population, it means that we're more dependent upon getting the Pfizer, getting the Pfizer into the territory and making it available for youth, so that we can come closer to the levels of vaccination that some of those other jurisdictions have achieved, that have made them feel it's safe to ease measures to that point.
Amalo nalone magillugo takwa estamagillugo inusunne said hanimagiko tana Pfizer tamaunga Nunavut mutikisi taukana katagona ne akata atuina kote taulune inusutui makutui kapajaw katagona kulluge amalo kilili otaustimayune ismalo nalwagonne kan aula kata onnastikanne kanu aula titi kanne kata onnastine angata istimalo nato kalwangilone
togi utak CBC kunni temangani kapisi kattarok titlugi tamani Nunavut amet kunni igiti kattara simarok bisi temangani pigerok titlugun. Since the vaccination started in Nunavut, has the government needed to throw out some leftovers that has not been used?
Yeah, there's been, I think for the Moderna, it's 2 or 3%. It's under 3% of the total doses we've received that has been wasted. The national guideline or accepted standard seems to be 5% or less, so we're meeting that. I don't know of any. I don't know if any Pfizer doses have been wasted.
Takwa Moderna kanimagi kuti tamani 2-3% me katilema tuwe atotawin ni kuigi tawtu nakata stimayu kana tame malige malitaw mane stimayu 5% me tungane simamata ta samanalani tungane magachu amalokaw yimangi tungata kwa Pfizer kanimagi kuti igiti tuwe nakaya kastima namangata atotaw ngini kuminani.
What have you learned since the mass vaccination started in Nunavut? Ano, ilitisimarak pisite mangani kapisakatang ng mitpigerok titugo Nunavut mami.
We've learned a lot, not just from in Nunavut, but from other, from around the world, that vaccines are effective, that they're safe. Certainly far safer than COVID-19 infection, and that they're a very effective tool for changing either changing the course or even stopping outbreaks.
Takwa ile pale rotigi simabi utitabo tamani Nunavut mitungi tukisiani namili tuinalema nunatwalema me Amalo atanangin astaulote kanwinangin astaulote nubat dewana 19 mo kanim magutaw batune amalo tana atuta katia balotune nokatiti balya gutaw balya matama tuminga sema palya simaningani.
President Torna, Tech News. Earlier this week, the Globe and Mail wrote an editorial saying that Nunavut, despite its large and early supply of vaccines, has the lowest vaccine rate in the country. What's your response to that?
Can you repeat that, please?
Sure. Nunavut, despite its large and early supply of vaccines, has the lowest vaccination rate in the country. That was in a Globe and Mail editorial.
Nunavut News kunni takwa Globe and Mail bibalya yulagaye tusatiti utakalaungata Nunavut mugu kanimagi kutini tikititi simabi yawagalwatiluwe katina unapango simamatago kapiyaw simayo.
Well, it's not entirely accurate, first off. If you look at the percentage of people who've taken 2 doses, ours is higher than many southern jurisdictions. If you look at percentage of the vaccine that we've used, has been delivered to us and has been used, it is higher than most, if not all, other jurisdictions, and there's a number of reasons for that.
Takwa na tema lata ngungito ukasimayo presenting amisuning takulowe kikutuine maawata to kapiyaw hatasimayo tamani amisuna saumata kalona nunangani to kapiyaw simayo saniani amalo takwa amisuning percentage kanimagi kutinyo nila kanimagi kuti kapisi utaw simayo atotaw simayo ubatino Tuniyaw simayo kaputistat amisuna saumata na sautingi takulowe kalona nunangani to saniani.
There's a whole bunch of things that affect how likely a person or members of a group are to get the vaccine. Age is one of them. The younger you are, the less likely you are to get the vaccine. And that's an obvious one that Nunavut is different from the other jurisdictions in Canada. My concern with editorials like that is it's often interpreted as either the healthcare staff have done something wrong or Nunavut have done something different than other people in southern jurisdictions, and neither of those are true.
Takwa amisu piyuta mata tamakununga kinatuinamo balone kikutuinano kanimagi kutimu kapayaw hatatuno istumagi lawi ukiungi takwa kapayaw gaya kapatu tamakwa nukatiunase inusumnase kapayaw katagaya kani ningi pi utigilu gitana ilanga pi utautako amalo Nunavut at igiyaungimat aula tibi kanatame asilimangi takulugi isimalo natillugu tamanna titarako simatillugu pivalia yulagayini isumanato te kuane atulagayini iqaneyati tema teangungitokai pijumini ubalo Nunavut tamanna kamagiyaw simaninga igisimangi magu tema ukausi simatillugu tako tema lata ukasimangitu.
Early in the outbreak, there were some concerns over cooperation with surveillance testing. How are things looking like now?
Mana kanimana tunuwatwana tungila saya masti majumini utilugu mana le kanuilinga la katamanna.
It waxes and wanes. When we get a cluster of cases like last week, the number of people showing up for spontaneous testing goes up. And then I expect that as those cases recover and it becomes less of a concern, then we'll see less people asking for surveillance testing.
Takwa ige katangi mata amiso kena patute katina upala patute amalo atautiku nabatu wana totasma yokatilogo solo pinaswa siula utme na sautingi amisoko kena kata tuti umata kisiane istimalo nangena stali tamanna kawi satautia kata tilugo.
Trevor, right now in the news. As the CPHO, what would you say to the people who entertain the idea of being used as lab rats with regards to vaccines?
Trevor Wright, Nunavut News Kunni, Lutat Rangutiloti, Kanoli, Istumagi Biotana, Ukasi Katatilogo, Kawisao Twin Nagasatin, Kanimagi Kutimo, Kapia Kata, Nitini, Sibulio Luta.
Moderna and Pfizer were tested and researched as much as any other vaccine when they entered the market. They completed phase 1, 2, and 3 trials in order to demonstrate that they were safe and effective. As we've discussed in the past, like months ago, they accomplished that in such a short period of time by doing all 3 steps at the same time and by putting a much greater investment into getting this done.
Takwa Kanimagi Kuti Moderna amma Pfizer Pit Utigilugi Kanimagi Kuti Kapota Katatu Kawisauto Simamata Sibula Metuiliani Pingajuanillo Kawisauto Simalote Taku Titi Utao Simalote Atanangini Atuta Kaunangini Ako niyong itugal taman na kamay giyaw sa kaya laos si matilugo kanoto ko tao si mayon at tanang tukulugi.
And the vaccines or the territories and some other groups in Canada were prioritized not as part of a research agenda or research project, but because as a nation, Canada recognized that there were unique vulnerabilities and unique challenges in the Northern Territories that made sense to front-load vaccination in the territories to try and prevent or minimize the impact of the outbreaks that we have seen in the north.
Takwa kanimagi kuti utigillugi tamane Nunavut la ukiotatumi ammalo tamakununga Nuna katigi gotinu tamane ukiotatumi tunu kawisa gotauluni piliriangungimma takwa nuna leuluti kanatame istumagi yauluti istumalo nanastauninginni ukiotatumi ute istumagi yausimaningin ute ma sibuleuti taugumasima simamata tamana utigillugu tema atoktauluatu.
It's a bit early in the Pfizer rollout for a number, but is there a common wastage percentage with regards to the Pfizer vaccine?
Tāna pi utigillugu qanimmagi ko Pfizer amistuuningi atottaunginni kui igitautuinna qattattuni teema amistuutigiyuni pitaqaqqa.
We keep it as low as we can, and again, the common threshold across the nation is 5%. If it's under 5%, we're probably in the same ballpark as other jurisdictions.
Tākua appasittu amistuuningi istumagillugi tamani atottaunga yoqattanga atottaunginni kui 5% mi pammata tungaanilu tamani paluttugu nalunangittu.
Tobi utak CBC kuni una sivuratimo dorangayok. This is for the Premier. Tema ini kangatautik saktagun naksing mata kisiani Canadian North ku ukaktutik government kuni ikayok tawngin nakakangota suri 2022 mo kano government ku Nunavut mi ikayok tigi simarak pat kinaw yang ni temangani nubagtrang nakpikchit bigyak daltik tugur kanok litap ko pang nagtaw simabat kinaw ye government kuning ngaktud temang nga kayo sinasugyak tugur. Airline bookings are up, but Canadian North says it will continue to need government subsidies into 2022. How much money has the government of Nunavut given the airlines since the pandemic started? And what funding plan does the government of Nunavut have with the airlines going forward?
Takwad tingmihuli kut Canadian North and Calmer bilir katigin naktagut kinaw yung tunik takluit kinita na kinaw yak tunik taktabut government to hakuni ilang pitta maslu ta na kinaw yung tek na toanga yung Iqaluit yung takwa katalangi mata kinaw kut takwa tingmihuli kut aulat tu lamata Kianata na kina toragang ito takwa ting mihuli ko kina lew na mata takwa ikayutaw hinakto nokalang mata man pila kati yabuhuli June nung wano tikid lugo atilew himayumit kina yung pakatugo tana ikayok taw kanarang na pata June 3rd yung atanot kakatigid na mo ama atilew himayukod kabrinato contract piyumak mayugod. Thank you for the question. The subsidies that we give to the airlines, Canadian North and Calmair, is to keep them operational. It's not money for them to make a profit, and there's no money in there to give out for dividends or bonuses. We are working with them to make sure that they are operational and that we still have an airline within Nunavut. Our current contract with them, I believe, is to the end of June, and if they need any more assistance, we will be talking with them. The majority of the funds that we have been giving to the airlines is from the federal government funding that we have received to help them out. But just to be clear to Nunavut, we will work with the airlines to keep them afloat if they need be. They must show their books that financially that they do need our assistance, and also to make it clear that this money that we give the airlines to help them out is not for them to make a profit, but it's for them to make sure that they're still operational and we have an airline within Nunavut after the pandemic. Thank you.